July 1, 2023 and June 30th, 2024. Just to give you kind of a frame of reference for when this data is from. During this time, our program saw an increased need among our neighbors and assisted in the recovery from two major events in the county, including the January shooting in Perry schools and the June closure of the Tyson plant. So the Health Navigation Program is a resource referral program available to all Dallas County residents to really address those basic needs so everyone has the opportunity to thrive in our community. This program is available at no cost to anyone physically here in Dallas County. We often say that you don't have to necessarily have a permanent address here, but if you are here, we will serve you. We don't want homelessness or anything like that to prevent you from accessing our services. We work with people of all ages, all incomes, and we have the capacity to serve people in over 200 spoken languages through in-person and phone interpretation services. We all need help sometimes, and Health Navigation Program is available to everyone in Dallas County to really help shine a light in those dark moments. So this is our team. We have 3 full-time health navigators, so I'll ask you all to please stand up. We have Anne, Vivian, and Christina. Thank you so much. I've helped provide more administrative support for the program, and then we're also really grateful for the support of our director, Suzanne. So during our initial visit, we have clients complete an 11-question screening. This really helps us to gain a more thorough understanding of their presenting needs. Health navigators offer to help address needs that are identified during the screening, but the client is in charge. And so a lot of times they may decline assistance if it's not a priority for them or if they don't want to work on it right now. So you can see the last fiscal year in yellow, and then the previous 2 fiscal years are in gray to kind of give a context for some of the changes that we've been seeing in presenting needs throughout the county. So fiscal year 24, our team completed 581 screenings, which is up 4% from the previous year, and identified 1,246 presenting needs, which is up 31% from the previous fiscal year. This tells us that our clients are coming to us with much more complex situations, where they're screening positive from multiple areas of assistance more frequently. So the questions we saw the greatest increase in were the question was, in the past year, was there a time you needed to see the doctor but could not because of healthcare costs? Which is up 92% from the previous year. It's not one of our top presenting needs, but we did have 69 clients come to us saying that was an issue this year. The next one was, in the past year, have you had to go without healthcare because you didn't have the way to get there? That one went up 90% this year, and is almost double what it was the last 2 years. And the other question I wanted to highlight was, do you often feel lonely, isolated, or isolated from those around you? Which is up 83% from the previous fiscal years. Overall, the questions that received the most positive screens, while they didn't have as much of a jump from previous years, we're seeing more people presenting with these needs. Include those that said yes to the question, do you have concerns about your current living situation? Including housing costs, safety, or housing conditions. We had 220 people say yes to that question this year. In the past year, did you ever eat less than you felt you should because there wasn't enough money for food? We had 175 people say yes to that this year. And are there members of your household that do not have health insurance? We had 118 people say yes to that this year. So as I mentioned before, not all needs identified in the screening are addressed with a health navigator if the client doesn't wish to do so. The top need categories that navigators assisted clients in obtaining resources for included food, health, and housing. In fiscal year 24, health navigators assisted Dallas County residents in resolving 1,547 needs with a success rate of 87%, which is pretty good. As you can see in the yellow, fiscal year 24 saw an increased needs in many of our need categories. You may be thinking, but Abigail, the county is growing. Surely the data should match that, right? Well, both are growing, but not at the same rate. So when we look at the population growth, thinking back to the census 2020, we've seen an 8.4% growth in population, which is crazy fast. It's a lot. But when we look at our data here for health navigation, we've seen an increase of 29% need per client. So individual clients are coming with more needs than they were before, and a 44% increase in overall need amongst all of our clients, just in the last year. So, the need in Dallas County is largely outpacing the growth that we're seeing. And when we look at increasing need, we see it across all the categories, but especially in health, adult education, child-related needs, and employment. These larger increases are likely due to some of the targeted outreach that we did this year, as our team assisted and continues to assist with recovery that our county is facing the Perry school shooting and the Tyson plant closure. We had a lot of folks coming to us needing insurance, needing help with employment, and that's why some of those are higher. We also saw increased connection with transportation resources, which was largely due to an awesome collaboration with HERDA, which is a good reason why that one is higher than it was in the past. And that's because our navigators were able to help assist clients in completing a social determinants of health screening and access bus passes as part of the Flex Route project that they had going in HERDA. Overall, our resource connection success rate did drop 2 percentage points, indicating a larger burden of need than our current resources are potentially able to provide or have been able to provide in previous years. Our navigators and partners have done a really great job of trying to connect residents with the resources they need, but sometimes there simply isn't more money, or programs are at capacity and they have to get innovative. We often say that the number one reason a need is unsuccessful is because the client no longer wants to work on it. This year, we can still say that, but the no resources available to address that need category is a very close second. So the last couple slides are highlighting kind of the top 3 areas that we assisted our community as addressed in the full report, which I did bring copies of over on the table over there if you want a physical copy. Access to care is why the program was founded and it remains a top need. We see it in our community health assessment, we see it in our health navigation program year after year. For the purposes of this report, access to care is including both health and transportation. A large majority of these needs were connecting people with health insurance. Adult and child health insurance was the top by far that we connected people with, either through Medicaid or through the marketplace. Many folks struggled to find a dental provider that would accept Medicaid, so navigators were able to guide them through 2 providers that either know had openings or they know would accept their insurance. We also collaborated with Waukegan School District during their back to school fair to assure students had a medical and a dental home. So during that evening, we connected an additional 34 families with dental homes and 26 families with medical homes. As these families were not actually enrolled in the health navigation program, they're not reflected in some of these numbers, but I did want to point that out there because it was a really great collaboration. I hope they invite us back next year. Food security is always a top need, and it probably isn't a surprise, as we often hear, or we continue to hear from our peer-to-peer partners, how they're breaking records month after month. In addition to the connection to brick-and-mortar pantries, mobile pantries, and food assistance programs, our health navigation program also works with Aging Resources of Central Iowa to enroll older adults and distribute checks for the Senior Farmers Market Nutrition Program. And this is a large chunk of the food resources that we help connect people with. These vouchers provide $50 to older adults each summer that can be used at local markets to purchase fresh fruits, vegetables, and herbs. In fiscal year 24, we enrolled 142 older adults in this program, amounting in $7,100 brought back to the county and spent supporting local farmers. And the last category I'm going to point out is housing. Many of us have seen the increased housing costs ourselves. And these increased costs are sometimes forcing residents out of their homes because they can't afford it anymore, into new places that are more affordable. Or sometimes taking up so much income that families don't have that safety net savings anymore to really cover them in the event of a large expense. And spoiler alert, that's something that's going to come up on the needs assessment later this fall. Assistance programs are helpful, but are often not funded in the way Dallas County's grown, so that the money runs out, and then people have to get innovative in how they're going to come up with those additional funds to get them out of that sticky situation and back on track. Someone once told me, we don't have homelessness here in Dallas County, because we don't have a shelter, so we can't count it, we don't see it. And I'm here to tell you, we certainly do indeed have homelessness here, it's just not as visible. SAMHSA defines homelessness as an individual or family who lacks a fixed, regular, or adequate nighttime residence. In Dallas County, thinking about the clients that we serve, we have families living out of hotels, we have families living with friends or family while they can, hoping they don't get kicked out. We have families sleeping in their car or in a camper during all times of the year. We have families uprooting their families and having to go to the shelter anymore if there's room. And we have families that are living in poor housing conditions because they are afraid to speak up and advocate for themselves because they don't want to get kicked out because they can't afford to live anywhere else. So I know some of this data is kind of a bummer, but I want to end by saying that our health navigation program is here for Dallas County residents during their darkest hours, as well as during just slightly dim days when they don't know where to turn for help. 87% of the time, our navigators are able to find a resource to meet the need of that client, and that's pretty amazing. Anyone can refer to our program. We have no wrong door. You can call, you can fax, email, submit a referral online. I do know that there have been some glitches with the online form, so if that happens to you, let me know so we can tell our IT department so that way they know what's actually going on. But most of the time, they come through. And that's all I got. Like I said, I did bring some hard copies of the report, and I will include it in our follow-up email so you can have a digital copy of it. Does anybody have any questions about our health navigation program and what we've been up to this last year?